Hello, friends. Let's talk about circumcision, a topic shrouded with mystery, sometimes embarrassment, sometimes hesitation, and lot of taboo associated with this topic. So, why many people think that getting a circumcision will hamper their manhood. Some people feel that the smell from penis and your private parts is normal. Some people don't come for guidance because they think that circumcision is something which is done by a particular religion and is not needed or is not required for other peoples. These are all, let's deconstruct all these myths, misunderstandings, and taboos. And let's understand this topic through a medical perspective. When is this required? What are the conditions? What are the prerequisites when a medical practitioner and when a surgeon will tell you to get a circumcision done? Just on pure medical purposes, for medical conditions, not for religious or cultural purposes. In some communities, like in Muslims and in Jews, circumcision is practiced traditionally. As soon as the kid is born, there are few days or few months old, a circumcision is done as cultural and a religious practice. This is not practiced by other communities because of other considerations of their own religion, of their own customs and cultures. So, is circumcision absolutely necessary for all men? No, it is not. It can be done for various reasons. One is religious, other is cultural. In certain societies, it is done as a part of hygiene. But most of the people in India and in India does not get a circumcision done routinely. Now, for any individual to get a medical circumcision, an adult circumcision done is only done for medical purposes. So, what are these conditions where you need a circumcision? First and foremost is for hygiene purposes. Some people have constant smell around their private parts, and this smell bothers them or bothers their partner. If this smell is not going, say, with normal hygiene, which you routinely do by cleaning with soap and water and keeping the penis and the foreskin area clean and dry, and despite keeping it clean and dry, the smell persists, you should consider a circumcision. The second important reason for which circumcision is done is phimosis. If you have phimosis grade 3 or grade 4, you definitely will need a circumcision. It is the condition where you can't even pull your prepuce back and see the whole of the glans penis. The third important reason is in diabetic patients who get recurrent balanitis or balanoposthitis, that is the inflammation of the prepuce or the inflammation of the inner surface of the glands. If you are getting repeated infections, then you should consider getting the circumcision done. One more condition which is not as common is called as lichen sclerosus, which is with the foreskin becomes too tight. You can't even see the meatus where from the urine comes out through the foreskin hole. This last is an absolute indication to get the circumcision done as soon as is possible, because this is a progressive disease and can lead to the scarring of the glands and shortening and tightening of the external meatus where from the urine comes out. Then you might have to get repeated surgeries for that. What exactly is circumcision? Circumcision is a procedure where we remove the foreskin, or medically we call this portion as prepuce, for medical reasons, not for cosmetic reasons, but for medical reasons. Removing this foreskin is called a circumcision. How do we achieve this? This is achieved generally by three methods. One is a traditional method where we take a scalpel, remove the foreskin, and re-stitch the tissues. Second method is laser, where we again remove the foreskin with the help of laser and then stitch the tissues together. The difference between a traditional scalpel surgery and laser surgery is that the laser surgery is less painful. The chances of bleeding are substantially less, and the cosmetic outcome is little better. But the disadvantage of laser is that it can lead to burn sometimes. Happens extremely rarely, but is a possibility. And the third method, which has become popular over last few years, is ZSR stapler circumcision. This is a circular stapling device made to measure, Every penis size is different, so we measure this size before the procedure, and then according to that size we take the stapling device and remove the foreskin, and it has inbuilt staplers which close the skin along with the silicone ring. How much time does this circumcision generally take? If you are going with a traditional procedure with the scalpel and suturing, it will take 25 to 30 minutes. With laser, it will take around 15 to 20 minutes. The fastest and the quickest is ZSR circumcision. The anesthesia takes 5 to 7 minutes, and the procedure takes 5 to 7 minutes. And it makes a beautiful round cut, and there is practically zero chance of bleeding and very extremely minimal pain. There is hardly any pain post procedure, and you might have to take some anti-inflammatories for a couple of days. Generally, painkillers are not required. So, what is post procedure? How does it look after the procedure is done and you have left the clinic? Before I go on to the recovery, let me tell you how much time does the whole process take. So, if we walk into the clinic, we will take your blood pressure, monitor your vitals, do a couple of blood tests. The procedure takes 20-25 minutes, and in 20-25 minutes you will be released from the clinic and allowed to go home after you have passed urine at least once. That is the exact time it will take for you to get the procedure done. This generally takes somewhere from 1 to 1.5 hours. It is as soon as you enter the clinic, the procedure is done and you can walk off and go home. It can also be done in the if you have an insurance. Generally, insurances cover it if you're an adult, but you'll have to remain in the hospital for a few hours before we can release you. So, how does the recovery look, and how does the daily life look post procedure? After the procedure, we will do the dressing, which you will have to come back and get it removed after 48 hours. And then generally we don't advise any dressings. After the procedure and after the dressing has been removed, there will be some swelling which you will be able to notice over the penis. This swelling maximizes in 4 to 5 days, and then it starts to subside, and your penis will become near normal in 3 to 4 weeks. You can have intercourse with a condom in 6 weeks and without a condom in 8 weeks. You can take normal showers from second day onwards after the dressing has been removed, and then we will only advise you to put a small ointment around the wound area. No, now as to summarize, all of this is that circumcision is a very basic, straightforward procedure done for medical indications. There is nothing to be embarrassed about or feel taboo about. If the best way is, if you are having any problem regarding your penis and penile health, please come to us. We are there for you, and it can be resolved very quickly, and you will regret not getting it done earlier and suffering for so long. Thank you so much. I'm Dr. Mir Asif from Mirascare Clinics. Our clinic is in Gurgaon. If you like the information, please subscribe, share and comment. And if you feel that this information is needed by somebody, kindly share it with them. Thank you so much.